Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right 3, 4, and 8 region, the lower right 7, 8, the lower left 7, 8, 6, 7, 8. So, starting with the upper left 3, as you can very clearly see, we've got the upper left 3 which is impacted and it is positioned palatally, and we will show you just now in the axial view. There you go. So this is where the tooth is. You can see the root and you can see the crown is palatal to the lateral incisor and the deciduous canine. There is no cystic lesions where we can see. No pathologies can be seen, and you can see that the tooth is snuggled very comfortably around the palate. You can see that just behind the lateral incisor, it's actually erupted out of the parietal bone as well. The lateral root is actually in physical contact with the canine, so that's something to be kept in mind. The roots of the lateral don't show any resorptions yet or periapical radiolucencies, but they do show PDL widening. Moving to the upper left 4, there we go. This is the upper right 4, sorry. Nothing significantly problematic, no periapical radiolucencies. There might be a crack which is right here, but this will need clinical correlation on the buccal aspect. Moving to the 8, this is the 8 which is impacted as well. It's impacted just below the 7, as you can see right here. It is very snugly fit into the palatal aspect of the 7. And then there we go, that's the 8 right there, and the roots are fused. It's very well embedded into the tuberosity, and it's also positioned um, palatally. So this is the lower right 8 now. The lower right 8 is in a very intimate contact with the inferior alveolar nerve that you can see right here. And then moving to, it has two fused roots, but both of them are very intimately in contact with the inferior alveolar nerve, and that's something to be kept in mind. This is the 7. The 7 shows a restoration, but below the restoration we can see a significant amount of secondary caries, which is very close to the nerve. So clinical correlation is advised and pulpal diagnosis is necessary, but we can see that at this point the restoration, the secondary caries is in contact with the pulpons, so there might be a need for endodontic treatment. Moving to the lower left 6 missing area, this is the lower left 6. Let me just show you right there. We go. We've got a very small and a very weak ridge right here. The bone quality here is D2, and the cancellous bone is not very well. We've got 6 millimeters of ridgewood below the crest, and we've got an approximately 9 millimeters of height. So a small and a slightly thicker implant can be placed, or we can also suggest placing two implants, one close to the 5, where we have approximately 6 millimeters of ridge width with 10 millimeters of height. So a narrow implant here, a 3.5 or 3.8 here, and then we can place one right here. It's going to be a slightly short and fatter one, a 4.5 and a shorter implant. So that can also be done. Then this is the 7, and then this is the 8, which is also again very intimately in contact with the inferior alveolar nerve. The upper left 8 is also very much impacted. It's also very snugly fit into the 7, as you can see right here. This 8 is also positioned palatally, and it just has one fused root. All the roots are fused, so it has one big root embedded into the sinus as well and the tuberosity.